Good day, everybody. My name is John Heeksakkers. I'm urologist in Maastricht, the Netherlands. And my colleague, Mireille Musquera from Barcelona, Spain, will talk with me about ins and outs of kidney transplantation in Europe in 2023. So, hello, Mireille.
Hello, John. Good morning.
Yes. Well, we did a plenary session on kidney transplantation this morning, and you were talking about the ins and outs and perhaps difficulties with living-related donor nephrectomies. What can you tell about that? What are the edges that we should look at when we think about those, let's say, patients, but also the procedure?
So living donation is really important because we need kidneys for transplantation, and the cadaveric setting, it's not enough kidneys for that. There are many differences around Europe on living donation and also the cadaveric rate. But the importance of the living donation, it's there because they give better results to the recipients, and also it's a source of kidney transplant. So it's a difficult surgery because you are operating in a healthy individual that gave a kidney to someone that he loves, and you have to minimize the complication rate, and you are careful always during a surgery, but in this case you have more stress and because you don't want to injure anything, and also you have to obtain a kidney that has to be transplanted, that has to work correctly in the recipient.
Yes. So is there a special preparation for people that want to donate the kidney to a relative or to someone they even don't know? Are they well informed, and how is that going in Spain?
So in Spain, and I think that it's everywhere, they have to pass a lot of controls, and you have to check if it's really a healthy individual. And we have to select the donor for the and the recipient, and also it has to be a compatible test, and they don't have to get any illness, or also you can get some donors with some kind of hypertension, but you have to really take into account a lot of things. And then they pass through a multidisciplinary team that they have to be seen by the a nephrologist, by the urologist, anesthetist, and also they pass a psychotest with a psychologist, and they are really informed about the complications and about the issues that they can have.
Yeah. Now, you are in Spain, and in Spain the transplantations are always done by urologists?
Yeah.
Nearly always?
Always.
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 That's also the case in Portugal. I think also in France, and a lot of it in Germany. There are always, and also countries in Europe that are not involved in kidney transplantation, only when trouble comes in, well, after transplantation. So in those countries where the urologists are not directly involved, what would you recommend what the role of urologists could be before transplantation, but also afterwards?
I think that the transplantation is a really nice surgery because you can get a kidney that it's almost dead, no? Because it's cold, and then you place the kidney to the recipient, and it started to life again, and you can see directly how it's urinating. So I think that it's a surgery that we do not have to lose as a urologist. And these countries that they don't are involved, I suggest to the young people that I think that it's important to get involved and to try to I don't know, the countries that never did the kidney transplantation, but if not, to start involving in it. And it's for that I think that these meetings where we have 4 sessions, for example, in this year, no, a thematic session, also the session that we had this morning, and the video session, and also the abstract. So I think that all young people has to be involved and has to interest on that, because it's really nice.
It's real urology, isn't it?
Yeah.
Certainly, yes. Well, we had this morning a good presentation by Fiona Burkhardt, who said, okay, if you have a young person who has not a very well urinary tract with a high pressure, low volume bladder, you have to do with that. You have to deal with that. You have to perhaps replace it, augment it, do a neobladder, do an ileal conduit. That really is the surgery that we know about and that we can do. For me, that means that that's a real role for urologists to do that when it's necessary. Happily, it's not that often necessary. Controlling of patients after the transplantation, what does that imply?
So for the first part, I think that it's for that we have to be involved. The recipient also has to be well studied, because if you have a non-compliance reservoir, so you will lose the kidney. So you have to know how is the voiding system on the patients to get a good results at the long term of kidney transplantation. And for the follow-up, you have the follow-up in our hospital, for example, we does the follow-up during the post-operative care of the recipient, and then we saw them in the first visit in the clinics, and after that is the nephrologist that takes into account the patient and follows because of the immunosuppressive treatment and all this stuff. If they have any problems, urological problems or surgical problems, we see it right away. But this is true, depends on the hospital. There are hospitals that the transplant surgeons make the kidney transplant and the immunosuppression and also the follow-up. Yeah. But it's how we work in our hospital, and I think around Europe.
The routine can be different, huh? Yeah. There was some discussion about, can you do surgery on patients after renal transplantation, for instance, prostate surgery? Yes. You can, definitely. There was a debate on whether you should do a lot before the transplantation in the recipient to find out how the urinary tract is working or not. People say, okay, you find it out afterwards and then we correct. That has to be put in the European guidelines still, isn't it?
Yes, I think that we have to put it in the guidelines, in the transplant guidelines, but we will work on that.
Yeah. Perhaps that's also a good reason for young people to join us and to make progress there, and then they can also appreciate what renal transplantation means for urologists. Okay, thank you very much. Thank you all for listening and looking at this small video, and we wish you a very nice stay in Milan.